Hi, my name is Ross Jacobson, and today I'll be looking at the case of the not so fresco queso. Is it an outbreak, epidemic, disease, or condition? Well, looking at what we have, according to the World Health Organization, a disease outbreak is when cases of a disease are in excess of what we would normally expect to see. For an epidemic, it is defined by the World Health Organization as the occurrence in a community or region of cases of an illness, specific health-related behavior, or other health-related events clearly in excess of normal expectancy. A disease would be referred to as a broad array of health-related states and events, including diseases, injuries, disabilities, and deaths. What is a condition? Well, it is a term that refers to a person's state of health. For example, a patient's condition in the hospital may be described as good, stable, or serious. Conditions may also refer to a normal state with regard to one's health, such as pregnancy or to a disease, disorder, illness, or injury. The Center for Disease Control issued a notice of an investigation on February 6, 2024. This investigation involves the outbreak of Listeria monocytogenes infections in several states. The investigation began in 2017 and again in 2021, when they considered queso fresco a similar cheese as potential source for an outbreak. However, there was not enough information to link the outbreak to a specific brand. Then the new outbreak in 2024 began. The investigation is now reopened as of January 2024, when new illnesses were reported in late 2023, and the outbreak strain could be linked to cheese from a particular brand. With this new information, the CDC, public health, and regulatory officials were able to conclude that queso fresco and cojita cheese made by Rizzo Lopez Foods were the likely cause. Centers for Disease Control and Prevention found this information. What is listeria? The Mayo Clinic advises that listeria infection is a foodborne bacteria illness that can be very serious for pregnant women, people older than 65, and people with weakened immune systems. It's most commonly caused by eating improperly processed deli meats and unpasteurized milk products. Further quoted by the CDC, healthy people rarely become ill from listeria infection, but the disease can be fatal to unborn babies, newborns, and people with weakened immune systems. Prompt antibiotic treatments can curb the effects of listeria condition or infection. What is an outbreak? Applying the World Health Organization definition of an outbreak, it is when cases of a disease are in excess of what we would normally expect to see. The illness potentially caused by the cheese would amount to an outbreak. And as we see, there were 26 cases of the illness, 23 hospitalizations, 2 deaths, and it spanned over 11 states. Who was affected? First, it should be noted that the CDC believes that the true number of those affected is likely higher than the reported number. This can be attributed to the likelihood that most recover from listeria without medical care, and even those treated may often not be tested for listeria. Also, because this is a new study, some data may not yet be reported to agencies collecting this information. When looking at those affected, the table provided by the CDC lists the 26 sick people in this outbreak. There was not any information available for the following: religious affiliation, socioeconomic class, occupation, or marital status. However, we saw that the range for age was 1 to 88 years and the median age was 52. When looking at sex, it was 58% female to 42% male. When looking at race, 71% were white, 5% were Native American or Alaska Native, 24% reported another race category. And when looking at ethnicity, we see a higher proportion of Hispanic people, amounting to 85% Hispanic and 15% non-Hispanic, being affected by this illness. When looking at the places affected, the outbreak could be traced to 11 different states within the United States. The map reflects that California had the greatest outbreak, with 8 of the 26 affected being found there. Arizona and Colorado each had 4 cases. Texas and Tennessee each had 2 cases. Washington, Oregon, Nevada, Florida, Georgia, and North Carolina each had 1 case. The study did not further break down the incidents by county, city, or neighborhood. However, in reviewing the map, it can be seen that the Midwest, Northeast, and New England were greatly unaffected. Physical environment, climate, water, and air. Why there are less cases in the Northeast, New England, and Midwest areas of the United States? Is this because the cheese is not distributed in those areas? Or can this be attributed to the physical environment of the climate in these areas versus the areas with these cases? The areas unaffected have lower temperatures, and the diseases can grow in temperatures ranging from 1 to 45 degrees Celsius, which is about 34 to 113 degrees Fahrenheit, while the optimum temperature for full functioning of the disease would be from 30 to 37 degrees Celsius or 86 to 98.6 degrees Fahrenheit. Looking at the biological environment, flora and fauna, Listeria monocytogenes are widely distributed in nature, and they can be found in soil, water, vegetation, and the feces of some animals and can contaminate foods. L monocytogenes are ubiquitous in nature and found in soil, water, and animal digestive tracts. Vegetables may be contaminated through soil or of the use of manure and fertilizer. Ready to eat food can also become contaminated during processing, and the bacteria can multiply to dangerous levels during distribution and storage. Food most often associated with Listeria include foods with a long shelf life under refrigerator, as L-monocytogenes can grow to significant numbers in food at refrigeration temperatures when given sufficient time, and foods that are consumed without further treatment, such as cooking, which would otherwise kill L-monocytogenes. Looking at the social environment and cultural traditions, both queso fresco and cotija cheese are considered Mexican cheeses. This may account for the obviously heavily weighted allocation of these affected. As when mentioned in the ethnicity proportion, 85% were Hispanic and 15% were non-Hispanic. When those exposed are so heavily weighted to one ethnicity, it is likely that the cause could be something strongly related to cultural traditions. Here, the listeria is likely due to these particular cheeses that are more often used by the Hispanic community. Looking at this graph and the chart when the 26 people in the listeria outbreak got sick, recent illnesses may not yet be reported, as it usually takes 3 to 4 weeks to determine if a sick person is part of an outbreak. The true number of sick people in the outbreak are also likely higher than the number reported, and this is because some people recover without medical care and are not treated for listeria. But time was measured considering the year, month, week, day, hour, seasonal trends, weekly, and diurnal variations. And when looking at when people got sick, we see that it ranges from 2015 to 2024 in information, with a pretty large outbreak between 2021 and 2022. And that spanned over multiple times as we see different bands relating to each illness. And then we again see the breakout happening late 2023 and then early 2024. The lines represent the time when agencies reported illnesses and the sample collection dates, June 15th, 2014 to December 10th, 2023. While there was usually only one reported case at the times reported above, this incidence was above the normal amount expected and is therefore considered an outbreak. Here, there was a gap in reported cases for mid-2022 until the end of 2023. The recurrence of illnesses caused the CDC and other agencies to investigate the outbreak and locate the source. Good investigative work by epidemiologists likely prevented many others from getting sick by eating contaminated cheese. Here's my works cited. Thank you so much.